Hello everyone. In this short video, I will discuss about ARDS case definition. When to say a patient is having ARDS, that we will see in short. So ARDS is acute respiratory distress syndrome. Coming to the case definition, any patient of sepsis or pancreatitis, otherwise a case of pneumonia or commonly aspiration or even toxic inhalations. So in that scenario, such patients, if they develop new onset or worsening respiratory symptoms, for example, if you are treating a case of sepsis or some other infection, that individual starts developing new onset of respiratory symptoms. Similarly with pancreatitis. Otherwise, if you are treating a case of pneumonia or aspiration or some toxic inhalational injury case, which might be already having some respiratory symptoms, but there will be worsening of respiratory symptoms. Along with that, there will be bilateral opacities in chest imaging. So all these respiratory symptoms and bilateral opacities developing in less than 7 days. So in that case, what we will think? If such individuals are having respiratory worsening symptoms with bilateral opacities. So in that case, we will think it might be due to excessive fluid load. So the case is treated with excessive fluid that might have led to respiratory symptoms and bilateral opacities, or there might be a new onset of left ventricular failure. Third possibility will be ARDS. So for these two, what we will do? We will take the help of 2D echo or right heart catheterization to look for the various pressures and the IVC collapsibility. So all these things we will utilize to rule out these two conditions. If they found to be of non-cardiogenic origin, then we will think of ARDS. So this individual probably is having respiratory symptoms plus bilateral opacities because of ARDS. So as mentioned, we will be seeing chest imaging, commonly chest X-ray. In that, bilateral, patchy or diffuse, homogeneous opacities will be seen, which has developed in less than 7 days duration. So that case we will consider it as ARDS. But for this kind of imaging, we have to keep the differentials, which we can remember with the acronym NEC. So these changes should not be due to nodules. These changes should not be due to effusion or lobar collapse. So these should not be there to consider the reason as ARDS. So this is the overall case definition. Hope you got the point. An individual of sepsis, pancreatitis or pneumonia, otherwise aspiration, who has developed new or worsening respiratory symptoms plus bilateral opacities within 7 days of duration, which is not being explained by excessive fluid load or left ventricular failure, and the imaging is not fully explained by NEC, that is nodules, effusion and collapse. So that case we will consider it as ARDS. Now if you think how these opacities are formed in ARDS, that we will discuss in next video. So the pathophysiology will be discussed in the next video.